Swasthya Vidya Vahini, promoting health literacy in the community. Good health is more than the absence of disease. It contributes to improving quality of life and empowerment of people. In fact, health promotion is a key factor that revolves around the Sustainable Development Goals as specified by the World Health Organization. Keeping in tune with this, Government of Andhra Pradesh opted for Health Promotion Initiative to focus on community health as an integral component of its overall development strategy. And to do this, the Honorable Chief Minister of Andhra Pradesh, Sri Nara Chandrababu Naidu, came up with an innovative idea to launch Swasthya Vidya Vahini, a health promotion initiative to ensure health literacy among the people, reduce the disease burden by enabling the people, including school and college students, to make right choices for healthy living. It is fueled by the belief that health is a fundamental human right.
Swasthya Vidya Vahini is a very good program launched by Government of Andhra Pradesh, first of its kind in the country. In this, all the medical students, dental, Ayush, home science and nursing school students will go to the villages one day in a month. They have 10 subjects to cover, like personal hygiene, communicable diseases, lifestyle changes, physical literacy. Like that, there are 10 subjects. So the villagers will know what will help them in taking care of their health, and the students, by going, they will know the reality in the villages, and they will develop their communication skills also. They will first go to the Anganwadi centers, meet the mothers, then they will go to the schools, then they will educate the whole village. So the main concept is we may want to make Andhra Pradesh as Swachh Andhra Pradesh, Navya Andhra Pradesh and Arogya Andhra Pradesh. In this, I request all the students to participate in a very active manner and be a part of this.
Andhra Pradesh has approximately 3.5 crore rural population, residing in 17,363 villages spread in 13 districts, with an average of 25 to 30 lakhs people per district. Central to any effective health system is sufficient number of capable and committed health workers, particularly so in more remote areas. Department of Health, Medical and Family Welfare, Government of Andhra Pradesh has ensured that Swasthya Vidya Vahini program aligns medical education consciously towards improving health and healthcare provision for the people, particularly in the rural areas.
Swasthya Vidya Vahini program is envisaged to ensure that health education is taken to our public, particularly living in remote and interior areas in the villages, through the medical students. This is a wonderful program because it provides an insight of the problems related to health in the villages to our students who are now studying in the medical colleges, which will make them more sensitive to the health problems of the public. Similarly, the knowledge that they will impart to the public, particularly on preventive health care, will go a long way in enabling public to manage their lives and be able to prevent most of the diseases. Today, primarily we are having a large number of population suffering with diabetes and blood pressure, obesity, and this is increasing over the years. And these are the basic reasons why other diseases come. So it's very important for us to educate people on right eating habits, on right living styles. We have large population of women who are anemic. despite the fact that we have large number of very affordable food around us, the consumption of which we can get over anemia, but simply the lack of knowledge is the barrier between good health and availability of resources. Therefore, it is important that Swasthya Vidya Vahini program is used to bridge the knowledge gap. It gives a wonderful opportunity to the students to understand the society even before they actually start practicing. And I request all the students to take this program as a social service and also empathize with the problems that people are facing in the rural areas. Once you see these problems and interact with the public, you will find better solutions to these problems as you grow up to be full-fledged registered doctors.
The state has 29 medical colleges, 15 dental colleges, 126 nursing colleges and 13 home science colleges. These include both government and private colleges. Presently, about 48,000 students are pursuing various courses in these colleges that also include students of Ayush courses. Out of these, 23,000 students in SVV teams of 2 each are attached to Chandrana Sanchara Chikitsa, a mobile medical unit that has a doctor, a staff nurse, a pharmacist, a lab technician and a driver. The MMU functions as a PHC on wheels and visits 2 Gram Panchayats a day. There are 277 MMUs plying in the villages. The students are trained to propagate messages on health literacy to men, women and children in the villages. This not only exposes and sensitizes them to the health issues of people living in rural areas, but also helps them to develop soft skills, which is a key component for progress in their career.
Swasthya Vidya Vahini is a massive health education initiative launched by the government of Andhra Pradesh. Single largest health education program being taken up by any government in the entire world to educate the population on preventive health care and healthy lifestyle. The medical students, the nursing students, the dental students, by participating in this program will gain immensely because they are going to learn the realities in rural India. And your positive attitude and your positive thinking should be reflected when you go to the villages, when you encourage them to adopt healthy lifestyles, adopt healthy habits for healthy living. And will carry a lot of weight because you are really the future doctors, the future of India. You can only build a healthy Andhra Pradesh, a healthy India.
The success of the program is based on the strong student network belonging to the medical fraternity and the health department. Participatory micro-planning and close monitoring of the program at state to district to Gram Panchayat level by different departments is facilitating the implementation process effectively. This begins with the Director of Medical Education allocating few MMU vehicles to each college along with the list of villages attached to each MMU. The formation of SVV teams to MMU vehicles is done in the presence of student representatives as per the choice of the students. The selected students attend training program conducted by their respective colleges on subject material for SVV and soft skills. They are instructed not to promote or prescribe any system of drugs or medicines during their visit to the villages. The SVV team is attached to the MMU vehicle. 1 Gram Panchayat is allotted to a SVV team of 2 students. Each student is provided with a sling bag that has a SVV booklet, a nutrition booklet, MCB card, an SVV badge, a cap, notepad, pen and formats. The formats are used for noting down observation during transect walk. Institutional formats are used during Anganwadi, school and Panchayat visits. A health supervisor is attached to one Gram Panchayat. He reports at the college by 7 am along with the SVV vehicle. The health supervisor hands over to each student the village health profile along with an envelope enclosed with a letter from the Honorable Chief Minister and 100 rupees towards their expenses. The students will be provided with the village data when they are about to start the field trip. This will have the demographic information, pregnant and lactating mothers, infants, children and the disease pattern in the village. The SVV team writes the time of departure from the college and sign in the register before boarding the vehicle. The picture of the student team and the health supervisor is captured and uploaded before they leave the college at 7 am. The SVV vehicle with the one team and one health supervisor reaches the village where the MMU vehicle is scheduled for the forenoon in the first phase. In the second phase, the SVV vehicle takes two SVV teams, drops one team at the first village and proceeds on to the second village scheduled for MMU visit in the afternoon. The students give the biometric attendance at the MMU when it arrives in the village. Each MMU vehicle visits two villages in a day, that is, one in the forenoon and one in the afternoon. The visits are scheduled in such a way that every village is visited once in a month. As such, each SVV team is allocated one Gram Panchayat and they visit the Gram Panchayat and the attached villages once a month for a period of 1 year. That is, 10 times in a year. The theme for health promotion is fixed for each month. The students will talk about the following 10 themes. Though these themes are identified as the focus discussions in the village, anemia, diabetes and hypertension will be overarching topics as their prevalence is high in the state.
Around 60% of population in Andhra Pradesh is living in villages and small towns and also in agency areas. See, a lot of people in these villages and people living in rural areas, they have not got much of understanding about the health problems. We have one University of Health Sciences for the entire state of Andhra Pradesh, that is Dr. NTR University of Health Sciences. In this university, we have nearly 220 colleges. So, we have nearly 30,000 to 35,000 students studying in various courses in the college. So, the government has thought, why not we send all these people who are in this health science university to various places in the community, create an awareness about the common problems and tell them also about various measures to take care of their health. And so, the students of health sciences, they will tell the rural masses about good food, hygiene and sanitation. At the same time, the students will have the benefit of talking to them and so developing good communication skills also. At the end of their posting in the rural areas, they will prepare a project, so that this project will show what are all the common problems in the rural areas, so that the government will have a first hand information about these things. That way, this Swasthya Vidya Vahini program is a multi-purpose scheme. It will help the students, it will help the rural public and also at the same time the government will have a benefit.
The SVV team is received at the village by the Sarpanch, village secretary, Anganwadi workers and Asha. The team commences the work with the transect walk in the village along with the Sarpanch and others, during which they build a rapport with the people, the focus being bringing health awareness among families and encouraging any symptomatic patient to MMU, sharing healthy living habits as per the modules and training provided to them. They record their observations in the transect walk format. The SVV team visits the Panchayat office during the transect walk and note their observations on water safety, solid and liquid management at the village. Chloroscopes for testing the residual chlorine in the drinking water is available with the mobile health units, and the students will test the safety of the drinking water using this and report in their observations if negative. They stop at the Anganwadi center to interact with the mothers based on the theme of that month. Here, a nutrition exhibition is displayed to enable the SVV team to educate the mothers on the nutrition aspects in day-to-day living. The SVV team visits the school in the village and note down their observations. They have midday meal along with the students. During every visit to the Gram Panchayat, the SVV team visits 5 houses in the village or hamlets in the afternoon and interact with the inmates covering the theme of that month. The students act as guides, role models and functional specialists to help the villagers understand the importance of healthy living and preventive health care. After completing this, the teams upload into the SVV web application their observations of the village and the institutions they have visited. These observations will be linked to the departments concerned for taking up necessary measures. Once this is done, they mark their biometric attendance at the health facility located at MMU's parking point and leave the village by 5 p.m. After reaching the college, the team and the health supervisor sign in the college register. February 2017 data is taken as a baseline, and progress in health of families of Gram Panchayat clusters is maintained monthly by the respective SVV teams. At the end of 1 year, they prepare a project report based on their observations, list out the outcomes in terms of disease burden or changes in health-seeking behavior, and submit it to their community medicine department or college. This is a part of their curriculum. The basis of the roadmap for change is that the learning environment of future doctors will extend beyond the teaching hospitals to the communities. The setting of the village visits will convincingly demonstrate how the quality of living affects the health of people and will orient the students towards preventive health care and how this can be brought about by working with the community. With health literacy to be inculcated among the rural populace, the Swasthya Vidya Vahini movement is bound to make a real contribution to the sort of health transformation that is needed in the rural areas. As more number of students take the village visits, educating the people on the benefits of leading a healthy life, health for all could soon be a reality. Utmost care is taken to ensure the safety of the students during this program.